Hello and welcome to Itentive Healthcare Solutions webinar. We're excited to share our NextGen add-on solutions for NextGen with you today. My name is Chelsea Grover and I'm the Marketing Communications Coordinator for Itentive. I'd like to take a moment to explain the process for today's presentation. First, I would like to mention that this webinar will be recorded, and we'll send out a copy of the slides along with the recording within the next week. Next, for those of you who aren't familiar with Itentive, I wanted to share a bit of who we are with you. We specialize specifically in NextGen healthcare, and we're getting data into, out of, around, and through NextGen. Basically, our goal in life is to make delighted clients by helping them get the absolute most out of their NextGen software investment. We are passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. Next, I wanted to mention an upcoming educational webinar that we'll be presenting on October 24th. We'll be presenting, ever wondered why your NextGen reports don't match? Do you find yourself running a report after NextGen where totals never seem to match? We've all felt an overall sense of frustration when it comes to balancing reports to NextGen, so we took the time to investigate these discrepancies. In this webinar, we'll review which reports should match and also examine unique instances where the reports may not. We want to provide you with helpful hints we discovered on why the reports may not balance and steps to take to avoid this irritation as well. We'll send out an invitation to that webinar a week before it, so keep your eyes peeled for that. Okay, so back to today's presentation. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Tom Seco is Itentive's Business Development Manager, and Joel Schultz is Director of Product Solutions at Itentive, which means that he and his team are the people that actually built these great programs and thus is in a great position to demonstrate it. So Tom, I'm going to pass the webinar off to you. Feel free to get started when you're ready.
Okay, thank you very much, Chelsea. My name is Tom Seco, and I'm the Business Development Manager for Itentive. And as Chelsea mentioned, we're going to go through a webinar that's going to cover 5 of our products as we go through the webinar today. And the format for the webinar is going to be that I'll talk at the high level about the product to give you an introduction to it, and then I'm going to turn it over to Joel Schultz, and he's going to go through a demonstration of the product. So we'll be flipping back and forth between our screens, and so you may see a little bit of a delay there, but it should only be a second or two. So to begin with, here's the 5 products that we're going to go through today. We're going to talk about our ChartGuard product, our ChartGuard OnDemand product, our Refund Manager product, and our Unapplied Tool, and our Billing Manager product. And then at the end, I'll give you an overview who Itentive is. But throughout the webinar today, you'll gain an understanding of 1, how the product works, and then 2, how these products can increase the efficiency at your practice or your health center. So the first product we're going to talk about is our ChartGuard product. And ChartGuard is a simple, easy to use, cost-effective downtime solution that ensures the availability of your patient charts during EHR downtime. So it is a business continuity solution and a downtime preparedness solution. What you'll get out of ChartGuard, what ChartGuard generates, is an appointment listing of the patients that are scheduled to come into each of your locations, and then you'll get a patient chart that contains that information there. And Joe's going to show you what that information is. But at the high level, the way the product works is at night, ChartGuard kicks off and goes out the appointment listing within NextGen, looks at all the patients that are scheduled to come in to the particular locations, generates the charts for those patients, and then begins to push out to each location the charts of the patients that are going to be seen at that location, so that they're resident there locally in case that location loses access to NextGen. And if that location does, the providers and the staff at that location can go to the PC where those charts were downloaded to and begin to or continue to see their patients with minimal disruption. So I'm going to turn it over to Joe, and he's going to take you through a chart and what it looks like.
Okay, thank you, Tom, and thank you everyone for joining us today. ChartGuard is a high-tech, low-tech solution. As we saw on that slide a minute ago, ChartGuard runs near your data center, and it uses a high-tech engine to extract the data and documents from NextGen and create PDF files, one per patient, that kind of represent your old paper chart for the patient that you can use as a low-tech solution to get to your clinical data when your complex system has failed you. ChartGuard moves these PDF files out to each site, which is an important thing about ChartGuard because the most common failure we see is the networking. So if your information was in the cloud and you couldn't get to your network, you can't get to the cloud then. So ChartGuard, in its design and working with our early clients, pushes the data to a specified location within each practice, okay, within each site on a specific PC. So what does this look like? Well, let's assume we have an outage. We go sign on to the PC that receives the ChartGuard charts each night, and we get a number of different things available to us. So we go into that folder that contains the charts, and we drill down into that secure folder, and we first see an appointment listing to tell us who's coming in. This appointment listing can be customized and can include other information. We have some clients that include the first 100 characters of the details field in the appointment because that's relevant to them on information they'll need while the patient's coming in. Okay, so you have this and you know who's coming in and when, and you also know how to access each chart. As I mentioned, each patient gets their own chart. Think of this as the paper chart that we had a number of years ago before we moved to EHR. So we're rebuilding that out of your EHR data so you have it locally when the system's down. So we go into our sample chart here, and these can be used electronically because they're PDFs. They can be read on virtually any kind of computer you have in the practice because almost every computing platform has a PDF reader, whether it's an iPad, an Android phone, a laptop, a desktop, you can read a PDF file on them. So when we talk about high-tech, low-tech, the high-tech's the engine, the low-tech is this PDF file that's easy to use when everything's down. Can be used electronically as a PDF, or it could be printed to paper, and that's where that appointment listing comes in, is that you can see when patients are coming in, and you know when to print those to paper, so you're not printing more than you need to paper. In fact, I was talking to a client yesterday, and they were starting to print the whole day's worth, and I'm like, no, just print them as you need them, or print them slightly in advance as you need them, because if the network comes up, that's less paper than you've wasted and now have to shred. So what's in these charts? The first page is a patient identification sheet. There's your module data from NextGen, so things like allergies, medications, labs. We also pull in documentation, ICS, and EHR. Now, if you are using these PDFs electronically, we give you a nice little feature of bookmarking where we've set each section into its own bookmark so that you can quickly jump between them and get to the information that you need. So what we're looking for with ChartGuard is that insurance and that confidence that should the system be down, your clinicians and especially your providers will know they still have access to that clinical data, so they're not going in to see the patient blind, not knowing why the patient's there or what their history is. It's kind of a win-win for everyone. So Tom, I'll go ahead and turn it back to you and we'll cover the next evolution of ChartGuard, which is ChartGuard OnDemand.
Okay, all right, thank you, Joe. Okay, so ChartGuard OnDemand. ChartGuard OnDemand is our next product, and what that does is allow you to generate a chart on in the moment. So if a patient comes up to you and says, "I like to have my patient chart generated for me so I can take it with me to my next doctor appointment," you can generate a chart for that person within 15 minutes or so. It's also used, what we did is we put a user interface on top of it that allows you to pick and choose what patients to generate the chart for or group of patients to generate charts for. And it's good for situations where you want to, as I mentioned, give the patient history to somebody, but also in cases of maybe audit request, when an audit request comes in and you need to print a group of patients' records, it's a good way to use ChartGuard OnDemand. So I'm going to turn it over to Joe, and he's going to take you through the demonstration of ChartGuard OnDemand.
So as we rolled out ChartGuard to clients for them to use in their downtime, they came back to us and said, you know what, we'd really like to be able to use this for complete medical history. Often for the downtime, we subset the medical history to what's relevant for a single patient visit while the system's down. But as Tom mentioned, what if you have an audit? What if you have the need to give a patient their chart in a readable format? What if you have a group of providers who are leaving your practice and want to take their data with them in a way that's very portable, but they don't want to have to deal with something that's not easily readable like CCDAs and such? Well, ChartGuard fits those requirements, and based on working with, again, several of the NextGen clients that were using the normal version of ChartGuard, the downtime version of ChartGuard, we created ChartGuard OnDemand, which uses the same powerful ChartGuard engine to extract the information into a single PDF file, but gives you the ability to choose the population that you want to create those PDF files for. As we look in the top left here, there's various search criteria, whether it's by date range or providers or names. So you can pick a single chart out of your system, or you can pick a whole range of charts out of your system. So we set that, we click find. If we want to generate these charts, we right mouse, we can select one of them or all of them. We can select them all and deselect. And then we go ahead and hit the request button and send those off to be generated. Now, while they're generating, which obviously takes several minutes, especially if you have a number of them selected, you can come back and check the history on that request to see what's going on. So we see here that just a few minutes ago, it finished generating a majority of the charts that are out there. So we can go ahead from here and we can pull up these charts one at a time. If you want to pull a whole bunch of them instead of doing one at a time, there's a designated folder that they land in, which of course would be secure, that you could take the charts and put them on an encrypted drive, and providers could take them with them. You could give them to the insurance company, or if it's just for a patient, you could simply print it out and give it to the patient. So these are very similar to what we just saw. So I can go into view mode. And again, it's that same ChartGuard engine. We're just giving you the ability to pick, instead of it being appointment-based for downtime, we're letting you pick based on population. So we also have those bookmarks in here so that you can jump between them. And now we have a lot more data in here because we're pulling the whole patient history instead of just a limited set you'd need for downtime. So ChartGuard OnDemand gives you the power to leverage ChartGuard to create these PDF files as you need them for the patient populations that you need them for. Tom?
Okay, all right, thank you, Joe. So now we're going to talk about our Refund Manager product. We just completed looking at our two EHR-based products, and now we're going to take a look at the beginning of our three financial practice management-based products. The first one is going to be Refund Manager, and what Refund Manager does is it streamlines and automates the credit balance handling and refund check processing within your organization. And we are able to do that because of the way that we present the information on the screen, make it much easier to find the credits balances on the patient accounts by using the search mechanisms and the filters that we have, as well as integrating with your accounting application in order to eliminate data entry points along the way. And you'll see this in the demonstration that Joe's going to go through. What you're going to see in the demonstration is the three modules that make up Refund Manager, and it's the Credit Scout module, the Batch Detective module, and the Importer module. The Batch Detective module is the module that's going to be used to find the credit balances on the patient accounts, and then to take an action on that credit balance, whether to issue a refund or distribute that credit to an encounter that has an open balance on it. And then you can also task it out for further research in the work log manager if you need to do some research on that particular credit. The second module you're going to see in the demonstration is the batch detective module. And that's the module that enables you to bring the credits that were identified as refunds over into your accounting application so that you would be able to print the refund checks without data entry. And then the last module you're going to see is the importer module. And that's the module that brings the check information as far as check number, check date, check amount of the printed check and put that back into the NextGen patient chart. So you'll see these three modules in the demonstration. And so we'll go ahead and I'll turn it over to Joe and he'll take you through the demonstration of Refund Manager.
All right, Refund Manager is an add-on to NextGen. We created Refund Manager version 1 back in 2005. So this is a very mature program which does a number of functions as Tom touched on. What I'm going to do for our quick demonstration here today is take you through the flow of it. I'm sure you'll have lots of questions, and one of the ways we can address those questions is by doing a one-on-one demo with your practice at a future date. What we want to do in our few minutes here is just take you through the process and show you how we streamline and automate the credit process in Refund Manager. So as Tom mentioned when he was talking about the different modules, we have the Credit Scout, which is really our NextGen facing piece. That's a tool where you can find credit balances in NextGen and pick whether you want to task them out to the work log, distribute the balances between other encounters where money is owed, maybe you were taking deposits and you need to apply those, or go ahead and refund the credit balance. So there's a number of search criteria up on top here to help you search whether it's one encounter, one account you're looking for, or a whole range of them. There's also some criteria to help you qualify, if it was truly due to overpayments. Let's make sure that all the buckets are zero or in a credit state. So a lot of good things in here that have been added and suggested by our Refund Manager client base over the 13 plus years that Refund Manager's been in use. I'm going to go ahead and click Find and get some of our sample data here. And we're going to pick some that are going to go through different parts of the workflow. So what we see here at the highest level are the guarantors. And Refund Manager works whether you're a single practice or multi-practice. Because we're looking at the guarantor, if someone had an account in several practices that you manage, you'd be able to see the balances in both those accounts in the different practices. However, if you're single practice, it works fine for that too. Or if your user ID just has access to one practice, we only give you the one practice that your user ID has access to. But what I want to do is pick a couple of these that we're going to refund through the process that have credit balances. So if we scroll down, we can see, again, the guarantor, the practice, who's getting the refund, whether it's an insurance or a guarantor, and then the encounters, and even down to the accounts. There's some great tools in here to help you do the research. We have screens that mimic the financial summary and account summary in NextGen. We can click on the encounter number and see the encounter view that you'd see in the chart. So we're trying to give you as much data in Refund Manager to help make those decisions. So what I'm going to go ahead and do here is pick several of these that we want to refund. And instead of having to go in and create transactions and do all the work of bouncing around between different patients, really all I have to do in here is pick the refund checkbox, this R checkbox in the middle here. So I can go ahead as I research my different patients and pick those that I want to refund. So they can be patient balances, they could be refunds to insurances if you want. So you go ahead and pick. This is the streamlining of the process. You still do the analysis, but when you're ready to do the work of creating those transactions, Refund Manager will streamline that and do that work for you in NextGen into your NextGen batch. Refund Manager also has the ability to distribute money. So we can go ahead and pick an account that we want to distribute. And distribute means to move money around, right? To not refund it, but we want to move it over to where it belongs. Maybe it was misposted or such. So by default, Refund Manager will move the credit from oldest to newest against debits oldest to newest. All right, but we can go ahead and do a preview and see what it's going to do. Now in this case, we have a credit for $295. So everything on the left here of the mouse is where the money's coming from, and everything on the right is where it's going to. So if we wanted to influence this, there's even a screen where you could pick, well, you know, let's go ahead and take this $295 credit and let's pay off this big balance first. So we'll pair those two together, and let's just pay off part of the smaller balance. Okay, so it makes it real quick to do that without you having to get in and do all those transactions. I'm going to pick another one here too to refund, and then we can go ahead and pick one that we want to send to the work log. So if you think about in NextGen, all the transactions you'd have to create to move money, do distributions, do refunds, put things in the work log, well, we're going to right click and pick to process the items, and it's going to come up with our screen, and it's going to say, okay, for tasks, what task type do you want to give it? Well, let's go ahead and pick one of these that are encounter based. So we can go ahead and I'm going to go ahead and just pick a random one here so that we can use it. Yeah, let's use that for now. Because I haven't picked one yet, it's asking me to pick one out of the database. This is your actual NextGen data. So if you're in NextGen and you're creating a task, it's going to ask you for these task types. So you don't need to redefine them again in Refund Manager. Because we've already done some refunds, we have the transaction codes that'll get used for patient refunds and insurance refunds. And then for the moving of money, we have the transaction codes for those. So if you think about it, we're going to create all these transactions in NextGen, so they need all the same information that you'd manually have to key in. So it's going to do 7 refunds for me, and it just did them in a snap without having to go jump around different screens in NextGen. It's going to add the one where I checked the T checkbox into the work log, and then it's going to ask us if we want to move around those credits against other charges and encounters where money's owed. So again, instead of you having to do all that work, it's going to go do them for you, and it's going to go ahead and plug them into a NextGen batch. Okay, so we can go ahead and balance out this batch, and then we'll go post it. And for the refunds, we need to get those out to the accounting system. The other stuff is really just kind of already taken care of, right? The distributions stay in the database, all that's good, but the refunds, we need to actually cut checks and get those moved over. So what I'm going to do is pull up one of these encounters, and we'll kind of follow it along in the process as we do the refund. Okay, so here's the transaction that was created for us. Lets us know in the transaction notes what batch it was put in by Refund Manager. When we're done, this will have the check information from the accounting system automatically without you having to do the data entry to put it in there into NextGen. It also created a note for documentation. Again, letting you know who did it, who it's going to, all that good stuff. It'll do another one when we push it out to the accounting system. So we've created all these transactions in NextGen for you, and we've helped you streamline the NextGen side of the equation. Now let's automate getting this into accounting and getting the check information back. So let's go back to Refund Manager and go into our next tool, the Batch Detective. And I'm going to set this back because this is just an older batch that I keep reusing here for these demonstrations. Here's the batch we just did, our 288.44 that we balanced out. And I'm going to export these out to the accounting system. We have a dozen accounting systems that we directly support. Some are file-based, some are what we call API-based, where it talks directly to the accounting system. And then clients have written their own integration to the accounting systems using our generic CSV and XML file formats. So instead of accounting having to do a lot of data entry, We simply export it out, and in this case, it's going to talk real time to our accounting system in the demo environment here, which is QuickBooks. If it was file-based, it would spit out a file that you'd simply just import in your accounting system. So accounting likes this because they're not having to key in all this information anymore. Okay, so we see our checks that are in there, and they're queued up, ready to print. And then accounting really just goes in, reviews them, makes sure everything's right. We'll even do the GL mapping for you. And we can go ahead and print the checks. All your reprints and stuff still happen within the accounting system. So if the checks didn't print right, we just reload the check stock and go again. So now our checks have check numbers assigned to them, right? And I promised you that that description field is going to have the check numbers in them in NextGen automatically without you having to do all that data entry. So it's sometime in the future after the checks are printed, we can come in and use the import tool, find our batches that have been exported and say, you know what, go ahead and import those check numbers, bring them into NextGen for us. There were 4 records just because it condensed the ones to the same payer, but there were 7 refund transactions. So it's just letting us know that it was able to update those. So if we pop back into NextGen, I haven't refreshed the screen yet, so it still has our batch here, but let me jump off and jump back. So it refreshes, and now we have the check number, check date, check amount documented in NextGen for you. Again, automating that process, making your refund processing more efficient. You can spend more time bringing in money, making sure your claims and stuff are going out right, and spend less time giving away money, right? Doing refunds and handling those credits. And that's really the equation for Refund Manager. It's a productivity tool that will save you hours and hours of time weekly and even more annually using this tool to do your refund process. Tom, back to you.
Okay, thank you, Joe. So the fourth tool that we're going to, or product that we're going to look at this afternoon, and the second of the financially related tools that we have, is the Unapplied Tool. And the Unapplied Tool is one that will enable you to efficiently and effectively manage your unapplied balances. And the way that the Unapplied Tool came around is over the past 10 years or so, we've been working with clients who have come to us and said, hey, you know, we have unapplied balances and we need to manage them somehow. Can you write some scripts for us? So we went ahead and wrote scripts for them over the 10 years, and we've kept these scripts. And during that 10-year time frame, we found out that you know, you have to, your unapplied balances come about because of various reasons. You know, they happen because at the encounter level, they happen at the account level, they happen because you maybe take a payment at the front desk and the encounter hasn't been created yet, so it goes into the unapplied bucket, and then you're supposed to apply that unapplied later on in the day, and it just doesn't happen, so that those payments continue to grow. What we also found in that 10-year period is that there's each organization has its own business rules as to how they want to deal with the unapplied balances at the account level and at the accounter level. And so what we did is we took all of those scripts over the years, put them into a program in a system, and put a user interface on top of it, so that now you can select from many different combination of rules at both the encounter level and the account level to be able to manage those unapplied balances. So with that, I'm going to turn it back over to Joe, and he's going to take you through the Unapplied Tool.
All right, great explanation of it, Tom. You know, that's been the problem. That's why unapplieds still, you know, exist as an issue for many NextGen sites. Is everyone's resolution for them is different because the cause is slightly different. So what we've done is we've taken a number of the common issues, and then we've taken a number of the not so common issues, and we put a user interface on top of this. And You go ahead and pick the rules you want to use and how you want to use them, and there's ways to kind of modify them so that they can resolve a high percentage of your unapplieds in your system. It's one of those 80-20 kind of things. If we can get the vast majority of them automated for you, then you can spend your time on kind of the stranger ones and figuring out how to resolve those. But let's go ahead and get, you know, everything we can have automated, be automated, so that you're not doing that work or not having staff do that work, get tied up on that. So on the left-hand side here, again, I won't go out into these in excruciating detail. We can do a one-on-one demo with your practice at a future date. But on the left here, we have the encounter unapplied rules. So what are we going to do with those encounter unapplieds? You know, do we want to apply them with a credit or apply partial amounts, apply exact amounts? Are we looking for specific amounts that we want to apply? Whole bunch of things in here. And then when we hit the end, if there's money remaining, do you want to move it up to the account? Do you want to create a task for someone to go research it? You know, you can do both if you want. One of the great things about this tool also is it lets you apply with a credit, which if you think about it, that's very useful if you're also using Refund Manager, because then you can get that unapplied moved to a line item where you can then do a refund transaction against it using Refund Manager. So this is the encounter side, what we're going to do with each encounter is unapplied, and then if we're going to move it up to the account. And then consequently, you have the account unapplied, where once you have this money on the accounts, what are you going to do with it? Are you going to leave it there? Do you want to task it out? Or do you want to start moving that back down to encounters? And again, there's various rules for it. There's options to just work them by locations or providers if you're trying to subset how many of those you're working at a time. There's transaction codes that can be ignored. Maybe there, you know, if the unapplied was a payment taken for a specific reason and it should be an unapplied, well, the transaction code you used to take the payment and create the unapplied, you could say go ahead and ignore those, and you can click there and pick which one you want. Maybe you don't want to start moving unapplieds until the balance is 0. On the other side of the coin, when you're moving the unapplieds to the encounter, you know, do you want to first apply it to specific SIMs, or do you only want to apply it to specific SIMs? So lots of great things in here, and it really gives you kind of a robust way to pick how you want to handle those unapplieds. Now in production, you'd set your rules and this would run nightly. We also give you the ability when working with smaller sets of data to run it interactively. When setting your rules, we have this test button that'll come back and just let you know, hey, you know, we're getting these results and here's what rules they match to. So you can make sure that the rules you pick are going to do something instead of waiting till the next morning and finding out you have an empty batch or you have more in that batch than you intended. So the test button is kind of a quick preview of what it's going to do. As I said, normally it would run overnight and the next morning you'd have a batch to review and prune out anything you don't want and post. We can also click run if it's a small enough set to run it interactively, and it'll show us the transactions that it created for us in NextGen. And then in NextGen, we'll have batches that you can go in there and take action on. By the way, this grid down here, you can save it out if you want to reconcile against it later to make sure everything's in there that you need. And as promised, we have these batches out here that you'd go ahead and work those and, you know, decide if you want to keep it all or just prune a few things out, and then go ahead and post them or set them up for the BBP to go ahead and post on your behalf. So that's the Unapplied tool. It's going to automate a majority of your unapplied sitting out there quickly so you can spend time on kind of the more problem child unapplieds that are out there. So as I mentioned, it works great with Refund Manager. And it has a variety of different rules because, as we keep saying, we found out every practice's need is a little bit different. Tom?
Okay. Thank you, Joe. So the last product we're going to talk about is the Billing Manager product. That's the third of the financially related products that we have. And Billing Manager really allows you to efficiently create multiple encounters for a single patient visit. And it's obviously you can do all of that work from one screen rather than have to go to multiple screens to do it. And you'll see how easy it is to use in the demonstration. Joe?
Okay, so Billing Manager, as Tom said, allows you to create multiple encounters for a single visit. If you think about it, if you're in a specialty that has a separate encounter for specialized equipment or surgery center or an anesthesia, all those types of scenarios, you may be bouncing around in NextGen between different practices or different encounters, or maybe within the same practice but different locations and encounters, and creating all those different encounters and charges. What clients asked us to do was create a single interface where they could do that much faster without having to move around in NextGen. So it's configurable, so you can set the number of different items that you want in here, the number of different encounters that you want to create, and you can do cool things like, pull from the base encounters insurance. When you do additional encounters, you can set the minimum and maximum number of encounters. You can select to use last insurance and so on. Well, let's get in here and walk through one, and we'll show you real quick how it works. So normally you'd have a base encounter that was created when the patient checked in. So you start with that base encounter, and in this case, I have it set up for ophthalmology. So we have the practice and the professional charges, but in addition to that, we may have surgery center charges too. So we have the option to either pick an existing encounter or more often create a new encounter for the surgery center charges. So it came in with our defaults for the practice and the location. We can set our facility if we want. Patient types available in here. The rendering in the practice became the referring in this set of rules. You can have it be the rendering also, but for this set that we set up, the surgeon would be someone different. So the original provider would then be the referring. So it automatically moves that down. We can go ahead and go into our provider search and pull up a provider, and then we can go ahead and create a charge. I'm just going to plug in a generic code here so we can keep moving along. And it'll allow you, these are the charge fields that you most commonly need to fill out in NextGen. And we're giving them to you on a single screen where you can also see the other encounter. In fact, we're pulling down relevant information like the diagnosis codes and providers and such. Okay, we also do anesthesia charges and calculations. So again, we can do a new encounter for anesthesia. We'll go ahead and set our provider again, and then we'll do a new charge. And we can pick an anesthesia code. And down here on the third line, we can put our anesthesia information. And it'll do the calculations for you based on the default payer for that patient and what's set up in the SIM for base units and charges and so on. So right now it's built all this in memory for us. It hasn't quite put it into NextGen yet, but instead of us bouncing all over NextGen to enter this in, different practices, different encounters, different charges, we simply hit save, and it'll go ahead and create all that in NextGen. In fact, I can pull it back up here, and we can see the information's in here. I can see in the surgery center, it was encounter number 30. So we can go back to our practice management, go to the surgery center, and pull up that encounter 30. Okay, that was just created for us. So it picked the date of the original encounter, of the base encounter. That's another option. We can see it was created today, but sometimes you're doing these other encounters well after the fact, but you still want them to be the date of the original encounter, the base encounter, because they really did all happen on the same date. So that's an option too that is configurable in the system. So Billing Manager created as a powerful tool to let you generate multiple encounters, multiple charges from a single screen when you have a patient who's coming in and you have these scenarios where multiple events happen. Tom?
Okay, thank you, Joe. So we just covered our 5 add-on products that enable you to increase the efficiencies and the effectiveness of the EHR side of the practice or health center and the financial side of the practice or the health center. We covered the ChartGuard and ChartGuard OnDemand products. Those are both EHR side products. And then we covered the Refund Manager product, the Unapplied Tool product, and the Billing Manager product. Those three are associated with the financial side of the practice. So a little bit about us. We were founded in 2003, and we have 20 plus years experience with NextGen and over 40 employees, most of which are consultants that travel from client to client, from practice to practice, health center to health center, working with the individual organizations to get the most out of NextGen as possible. We have worked with over 350 to 400 clients that use NextGen in this period of time. And you probably take the 2003 into 20 years and they do not add up. And the reason for that is Itentive started out as the IT department for a medical organization. And back in the late 90s and early 2000s, when the business mantra back then was focus on what you do best and outsource the rest, the medical organization was going to outsource the IT group. And leaders of the IT group said, well, if you want to do that, what we'd like to do is form our own company and provide services back to you. So they agreed to do that. And as I mentioned, from that point forward, we've worked with over 350, 400 clients that use NextGen. And we have become a strategic partner with NextGen in that time frame as well. What we do is we have a consulting side of the business, as I mentioned, where we can come in and work with you on improving workflows and business processes and revenue cycle management consulting. We have a group of developers that can customize templates within NextGen. We have a group of developers that have developed these productivity tools that we just talked about today. We also have a group of technology folks that can manage your IT environment from a managed services perspective, where we can manage your desktops, your laptops, your local area networks, your printers, and things like that. But we also have our own hosting center as well, so we can host clients out of that hosting center. And we provide support both for your infrastructure as well as for NextGen. And we can provide any one of these solutions as a point solution or in combination with one another to create an integrated solution for you as well. The next steps out of all this is, if you have an interest in any one of the 5 or combination of the 5 products that we covered, we can do an in-depth demonstration for you, so you get an opportunity to look at it more in depth and be able to ask questions as it pertains specifically to your practice or your health center. So if you do have an interest in learning more about it, my contact information is there, as well as Joe's. Don't hesitate to reach out to us and let us know your interest. And with that, what we'll do now is we can take some questions from you.
Perfect. Thank you so much, Tom, and thank you, Joe, for the demonstration. Again, if you have questions, you can type them in the questions box. At the moment, we only have 2, so if you have questions, we would be happy to answer them. Otherwise, you see both Tom and Joe's information up on the screen. You can always send them an email or give them a call, and they will be happy to answer your questions as well. So it looks like the first question is in regards to Refund Manager. Can it run in a hosted or Citrix environment?
That's a great question. Refund Manager is written in similar technologies to NextGen, the Microsoft platform, and it can run in both terminal server and PC or mixed environments too. So whether you're hosted or local, we can provide Refund Manager for you.
Great, thank you, Joe. Next question. Do I have to have ChartGuard to have ChartGuard OnDemand?
ChartGuard and ChartGuard OnDemand are separate products. So if you just want ChartGuard or you just want ChartGuard OnDemand, you can have them separate from each other. So you don't need one to have the other. They exist independent of each other.
Perfect. Well, it looks like that's all the questions we have. But again, I want to thank everybody for taking their time out of their busy day to join us. And please feel free to reach out to us with questions, and we will send you a recording in the slides so that you can go back and check this stuff out later as well. Tom and Joe, thank you for presenting today, and I hope that everybody has a wonderful end of their week.
Thank you, everyone.
All right, thank you very much, everyone.